Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejob since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communication Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
So welcome to Exploring Strategies to Strengthen Civic Participation for Communities' Health. Again, my name is Erica Burrows-Girardi. And CHR&R's webinars reflect the values that we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are values we aim to model during the webinar, and we hope that you will too. With that, I'd like to introduce you to the team that will aid in your learning experience. Let's start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica, and hello to everybody in the audience. Thank you so much for being part of today's webinar. We invite you to join the conversation today and engage with us during the live webinar. And there's two ways to engage. You can ask panelists questions by using the question box. So go ahead and open the Q&A box, and if you have a specific question, enter that there, and I'll be keeping track of them. During the Q&A portion of the webinar, I'll be queuing up the most common questions and we'll answer as many as we can during the live webinar. There's another way you can engage with us and other participants, and that's in the group chat. And I will turn it over to Colleen Wick, who will tell you how you can use the chat.
Thanks, Joanne. Really happy to be here. Hi, everybody. Like Joanne said, I will meet you guys in the chat. As you could see, the chat's already going, so please use the chat to share knowledge or respond to questions that we may ask you during the presentation. And also, please make sure to join us in making the chat space welcoming by adhering to a few guidelines. So use the chat to share successes, lessons learned, relevant resources, and links. Please make sure to engage in respectful dialogue. So as you could see, our chat conversations tend to be very engaging. So if it's too distracting for you, simply close out of the Zoom chat window. Also, please note that views expressed by speakers and participants during this webinar are their own. They do not represent CHR&R or Healthy Places by Design. And once again, if you have questions for the panelists, please use the QA box. So now I'd just like to pass it to our technologist, Erin.
Thanks, Colleen. I'm Erin Schulten with our operations team. I'm here to help you if you have any audio or video problems, so feel free to drop a message in the Q&A box if you do. As always, I'm glad to be here to learn from our great speakers about this topic today. So now back to Erica.
Thank you so much, Erin. People and places thrive when everyone can participate. CHRNR's recently released National Findings Report explores civic health, including how having a say in the decisions that affect our community and our future is connected to better health. I have to admit, this is an amazing report with some striking findings that you want to explore. So I encourage you to read the National Findings Report. We will make sure to include a link to the report in the webinar resource guide, and that resource guide will be shared with you later this week. Today, we're going to explore two ways that communities can have input in decisions that affect their future: participating in public meetings and voting. In some cases, our systems and institutions have erected barriers to participation that hurt specific communities, sometimes unintentionally, but sometimes purposefully. These structural barriers, as we call them, include policies, laws, and written and unwritten rules that have the power to influence one's ability to have a say in decisions that affect their future. Has your participation ever been affected by structural barriers like those listed here? If so, let us know. Put it in the chat. Our guests today are going to be uncovering some structural barriers to participation. So see if you can identify some and place them in the chat as they name them during the webinar. Our guests will also share some strategies to increase accessibility and better participation. So please join me in welcoming our guest. Benita Duran is the Senior Director of Equity and Civic Engagement at the National Civic League, and Dr. Stella Safo is the co-founder of the Civic Health Alliance. So ladies, thank you for joining us today.
Thank you for having us.
Thank you.
You can learn more about our guests by checking out their bios, and Colleen has already placed a link to the webinar resource page, so you can check that out. Now, we're going to have a discussion group right after the webinar to unpack what you're going to hear today. Please plan to continue the discussion with us. During the video intro, you heard about our discussion groups that follow the webinars. They're facilitated by Joanne Lee. They're always engaging. They give you the opportunity to share with and learn from others. And toward the end of the webinar, Colleen's going to chat out some information so you can link to that discussion group. And both of our guests are going to join us today, so I'm excited for it. And with that, I'm going to ask Benita to join me back here. And I want to start, Benita, by asking you, what is the Center for Democracy Innovation? That's where you're located there at the Civic League. So what is the Center for Democracy Innovation, and what is your mission?
Thank you. Erica, so let me just first say thank you very much for the privilege and the honor to be a part of this conversation. Like democracy, it's a big word, and there's a lot at risk at this time in our country. And I'm proud to be a part of an organization that has a deep-rooted history in working on these types of issues in communities throughout the country. So the Center for Democracy Innovation is a part of the National Civic League. The National Civic League is one of our country's oldest good governance civic organizations in the country. The mission of the Center for Democracy Innovation is really focused on sustaining democracy by inviting and encouraging people to help redesign their civic infrastructure in their communities. We're really focused on scaling democracy through strategies for inclusive engagement to improve equity and governance at the local level. And we're focused on measuring the quality of democracy and engagement, particularly in ways that really lift up resident and community voices. The Civic League itself has championed many of these democracy innovations of the early 20th century. And in addition to bringing in the Center for Democracy Innovation, the League itself maintains the Model City Charter which is used by cities throughout the country. We organize the All-America City Award program that many cities throughout the country have participated in for decades. And we publish the National Civic Review. We support an extensive national nonpartisan network of local elected, appointed, and civic leaders. So again, thank you for inviting me to be a part of this important conversation.
Absolutely. One of the reasons why we wanted to bring you to our platform is because you have a research project called Better Public Meetings. Let's share a little bit more about that. Like, what types of public meetings are you tracking in this project? And
Right.
how are better public meetings moving communities toward equity?
That's right. And who would ever want to talk about better public meetings?
Right.
That's a kind of a weird one, right? So through some national funding that we received from the American Arbitration Association and the Institute for the Center for Dispute Resolution Foundation, we were able to align a project around looking at how particular cities, a school district, and a community with boards and commissions could look at how they're shaping public engagement around meetings and community involvement. So there are 3 different communities that we were able to align with. So we started this project a year ago, and we're just wrapping it up in this month. So this is really a very timely and relevant conversation. 3 very different communities with so many different demographic measures that are so different and unique. And yet in this process, we found some very common themes across these communities that we looked at. One was Boulder, Colorado, and we worked with and looked at the city council and how a city council engages with its community. Fayetteville, North Carolina, we looked at their police community advisory board and their Fayetteville Next Commission and how those 2 advisory bodies engage with their city council and also with their community. And then in Mesa, Arizona, we looked at the Mesa School District Governing Board, so the school board of Mesa Public Schools, and how that governing board engages with their community. And in each of those communities, we found that they have a range of challenges in engaging with their community, that people value that engagement, but had challenges in connecting with the elected leaderships. And quite frankly, there were often issues around equity, right? Equity in terms of engagement and hearing people across the board in an equitable way. And so
I was going to say, let's talk about some of these, what you learned and from your study.
Exactly. And so sharing here just this example of how this process worked and how we looked at across the board a scan of that engagement. So we looked at how in this 4-stage effort, interviewed people in the community. So in this infrastructure scan, we talked to people in a diverse outreach effort to connect with people about how do they engage with the elected body or amongst community players, owners of the process, people who shaped some of these community conversations, those who felt left out of the community conversations, and to just ask, like, why is it that you attend meetings, or what gets in the way of attending meetings? We then captured that information and shared that information with either the school board, the elected officials, the staff of these organizations, to ask and to share the findings, to say, what do you think we could be doing differently? What do you think some of the challenges are related to some of the meetings or access to the meetings? And then we shared some ideas and some approaches and some technology innovations that they might consider in a process like that. And we're in this stage now of testing out some of these ideas or different ways of doing meetings or different locations where meetings could be held, so that they could determine whether there could be different connections with community that they might not have had in the past. So we found that we could bring forward these conversations and help to suggest the tools and the resources that could be integrated and practiced and bring more voices and equity into a process. in the study sessions, in school board meetings, for example, and hopefully lift up more equity in the conversations. And so in each of these communities, we shared the findings of these scans in the reports. And so in the next in the next conversations that we have, we hope to highlight more about what people said and what we learned.
Yeah, let's take a look at what you learned. What was the interviewee saying?
So what we heard commonly was that there really is a difference. I mean, people recognize there's a difference between being heard and being listened to and having that genuine sense of a connection when you do attend a meeting. And it encourages, when you do feel like you have spent your time wisely by attending a meeting and engaging with your elected officials or the community that you engage with, it matters. And you're not just, ignored or discounted by your presence. And it matters, and people do return and feel like they are a part of the community, and you're not just talking at straight faces who are not responsive. It does matter that people do acknowledge your voice when you're in a meeting, and it builds a stronger, more connected community. We recognize that meetings can be very intimidating to people and uncomfortable if you don't know the right way or the expected way to communicate. And it's not just the language barrier of Spanish, for example, and English, but it's often the vernacular, or it's the planning speak of, a hearing and not knowing the terminology of a decision or a process that people are engaged in a meeting. Those are some of the things that we were hearing in these conversations across the board in all of these communities.
Benita just listed a couple of structural barriers. I'm curious if you picked up on them. If you did, place them in the chat. And Benita, what you said reminds me of a friend of mine that told me that when she was participating in her Board of Health meetings, she would not know when it was the right time to speak on the agenda. And sometimes meetings, people had input into the meetings, but the community input wasn't generated on the meeting minutes. So if you didn't come to every Board of Health meeting, there was sort of like a gap in knowledge. So, you heard this from folks that you're interviewing. Anecdotally, I'm hearing similar challenges that people have when trying to participate in meetings. And, participating in meetings about decisions that are going to affect your health are important. But what do you do when you can't participate or when you don't know how to participate? That's an actual barrier. So I'm glad that you all are working on this project so folks can know how to have better public meetings. And I'm curious if elected officials have found this beneficial. Like, how have they responded to the innovative ways to boost civic participation?
Yeah. And we found a genuine desire for change, and particularly in this post-COVID-19 environment, right? Like and I wouldn't suggest that we're in a recovery, because I think we are all in various stages of recovery, if we are in recovery. And we are in different places in communities, and some places saw an increase of participation in meetings in a hybrid form. People would, connect remotely. In other places, it was less so. And then when people did return to in-person meetings, some of that on-screen hybrid connection disappeared or it increased. And so now people seem to be somewhat confused. Like, do I join in by Zoom, or do I come in person? And is there a different way of handling my input? And so just recognizing that that is a confusion amongst many communities, and just building that awareness too with elected officials when they're now in a platform with a screen and a monitor, that they need to recognize that they need to deal with different audiences that are in front of them in a room and also on a screen, and they need to acknowledge both of those elements. But what we're hearing from people is that human connection, that communication that happens between people is still so highly valued and makes such a huge difference in people's lives, and being heard and being listened to, and addressing the anxiety and the trauma that is associated with that connection in community, and sharing voice and sharing input on important decisions that are impacting communities. So we heard a great desire for change, not only from the elected officials, but from staff, from city staff that were involved in this process, and community members who want some consistency in how engagement's happening. Again, there was that common theme of confusion about when, where, why some of these issues are being discussed. Security and safety were certainly common issues, not only of both people coming to meetings, but also elected officials, and also, you know, health and that element of safety too, and for the people that wanted to participate. But people know that they have a choice, that, you know, life is too short, and you want to prioritize what is important, and you don't want this aggravation and this frustration, and you want to be in a community together, and you want to strengthen that. And so there just seemed to be a new energy that people wanted to align around in terms of addressing these kind of issues and paying attention to some ideas that would bring forth new energy and a new level of engagement.
Yeah, I love that. And I think I love the fact that you brought out the fact that elected officials are just as hungry for that connection as community members. But at the same time, these are real concerns. So it's good that you're bringing out what you're finding, so that way we can find, like you said, find ways to be in community together and work around some of those challenges.
Yeah.
So, what are some of the tools that the audience can use to structure better public meetings?
So, you know, the small group settings, and more of the smaller roundtable, instead of these open forum type settings with, you know, 2 minutes or 3 minutes at a microphone speaking to without a response or interaction. And so we found that, you know, they're more commonly referred to as like World Cafe small group settings, where people can convene and have a small group discussion, and then a report out and a sharing of that. Using technology tools like Mentimeter is a tool that that allows for people to use their phones or their devices to input a response, or to respond, you know, with a rating system on a scale, and that can appear on a screen, and so people can see that feedback and reaction, and so that's commonly shared, and you can see other people's reaction there too. So the room becomes, you know, more of a shared conversation with other people. And so you could see that people are maybe more aligned around an issue than not. And there's much more, you know, sort of a common shared knowledge of where other people stand on an issue. And sometimes that works better with larger groups. But it's also a way to also capture feedback when you don't have the time to, you know, you don't have a lot of facilitators around in a room, and you can't just chart out everybody's feedback. But it's also a way for elected officials to see, you know, a lot of community response that might not be able to be captured in a meeting. So those are common tools. And then using, you know, processes like citizens assemblies and other gatherings where people could come together to have these conversations that precede a study session or a public hearing, that could bring together you know, resident or community input on an issue before there's a decision, or before there's a official discussion about an issue. And so input from the community can be captured and represented in advance of a decision that's made by the elected body.
That's
Yes.
no, go ahead.
Yeah. And, I think there are resources that came forward from some of the communities as well, that what we were doing was stimulating that conversation that then prompted other ideas to come forward from a community that might not have surfaced, and just ways of responding that just opened up ideas sharing that might not have happened in communities that without
Yeah.
without that engagement, without even starting the conversation. So I think it just brought forward more positive energy than I would have anticipated in an effort that we engaged in.
I just love the ideas that came out, that's coming out of this project. And having those small group, like the World Cafes or the small table talks. I mean, what a way for everyone's voice to be heard, right? Because like you were saying, not, you have one person doing like a testimony at a meeting, you may end up with like five different testimonies, but you're only hearing from five people. So I love it. I love the technology. Mentimeter is fun, and I love the fact that both the elected officials and those participating can see results and have that engagement in real time. So thank you so much for sharing what you've been learning. And here's Benita's contact information. We encourage you to go to the Center for Democracy Innovations website to learn more about their Better Public Meetings project. We're also going to have some links for you on the resource guide so you can check out some of the reports and see what they've been up to. Thank you so much, Benita, and we will circle back to you during Q&A.
Thank you.
Dr. Safo, welcome back.
Wonderful. Hi, everyone.
What's the Civic Health Alliance and why did you create the alliance?
Sure. So I think, like Benita, we saw an area that needed a role to be filled. And so we created the Civic Health Alliance, myself and three other colleagues, because patients, especially during the pandemic, would come up to us and would say, Doc, I want to go vote, but I don't know if I'll be safe. I don't want to get COVID while I'm voting. What are our options? How can I be engaged in this way and keep my health, protected? And it was an interesting space for us to fill because many of us who are doctors feel like we don't talk about elections, we don't talk about politics, we don't talk about voting. But this issue was really brought to our attention in terms of the importance of it. And so we formed a group to really help around organizing in the 2020 elections, nonpartisan. We became more formal in 2021 as Civic Health Alliance. And then we have become a 501c3 with a mission that's really to provide nonpartisan input to increase civic engagement among healthcare workers, their peers, and their communities, because we believe that that will really help America as a democracy if we're able to impact the public's health. And so that's kind of what brought us to this place.
Yeah, wonderful. And if I called you Dr. Safo, forgive me, it's Dr. Safo.
No worries.
So, Dr. Safo, why are healthcare professionals hesitant about civic participation in their work setting?
Yeah, it's a question that we think about a lot and we get a lot whenever we kind of approach either an institution or individuals within an institution. The biggest thing that we hear is that people feel like they don't have the time. And I get this. When I see my patients, I'm an HIV primary care physician. My patients come in and they have 7 or 8 medical problems I need to discuss with them, 20 medications we have to review. So it isn't surprising that people often feel like they lack the time. The other thing is that we as, people in healthcare, as doctors, nurses, physical therapists, etc., we're used to being expert at what we do. We have trained for many years to do what we do. And so we tend to not always feel like we can engage around discussing issues related to voting or civic engagement if it's not our area of expertise. And then there's also this very interesting thing that people are often afraid, like if I talk about this, my institution will really push back against it. And we'll talk about why that's not necessarily the case. There's also just this kind of misperception that talking about things like voting and civic engagement suggests some kind of a political affiliation, when again,
we identify as nonpartisan. That's very important to the work that we do. And so one barrier is feeling like, well, if I talk about this stuff, it'll alienate my patients. There's many things in medicine that we talk about that could be off-putting, like the sexual health history. And there's all kinds of ways that we have to doing that discussion. So I would suggest that civic health or civic engagement is one of those things that we can just figure out how to do better. And again, the kind of fear overall of anything that seems political coming into the workspace. All of these are valid, and it's why we exist to really be able to address this.
Yeah. And how can they manage these barriers, especially what you were getting into, that dominant narrative that healthcare is, how can you overcome that barrier that healthcare is not political? Because the fact that that dominant narrative that healthcare is not political, that can be a barrier, right? That can be a structural
Absolutely.
barrier. And if people if that's flowing through their mind, well, healthcare is not political, then they feel like that's not something, that's a line I shouldn't cross. So how are you helping to manage that dominant
Yeah.
narrative?
I want to say first that I think the framing of this is really important. I think people are afraid that being civically engaged will bring politics into the healthcare space. And so what we want to do is just first explain what civic engagement is, and then we want to explain how to do it in a way that is nonpartisan within the healthcare space. So those are kind of the foundations of what we want to do. And so the case for us for civic engagement is a two-part case. I'll start with the easiest one, which is to make it easy. And so what we do is we've done all the work to create the flyers you need, the email signatures you need, these scripts that you'll need, all of it, to make it really easy to be able to bring these topics up, do this work within your different contexts. I think the harder part of this, though, is to help people make that connection from why are we talking about voting and civic engagement and how does it relate to health? So we make the case for health, and I'll make it here, which is that when we see folks participate and be more civically engaged, there is a tie to improved mental health outcomes. It's tied to higher socioeconomic status and education. And there was a systematic review that looked at individuals like self-reported health, and those who tended to vote also tended to report better self-reported health later on in as they kind of aged. There's also very interesting population level studies that have now been done again and again that show that places that have more inclusive voting policies also tend to have better population level health outcomes. And so that tie between some form of civic engagement, for example, voting, and health outcomes and population health outcomes, mental and physical health outcomes is present. And if we're really, kind of thinking about taking care of the patients as a whole, we have to consider the importance of civic engagement as one of our tools, as healthcare practitioners and public health folks.
So well said. And I'm sorry, Dr. Safo, I got to give a plug for our national findings report right here because we actually get into a little bit of a lot of what you were saying about those correlations. So check out our national findings report. Again, a link will be in the resource guide.
Good, I
So,
love that.
Dr. Safo, how can healthcare professionals model civic engagement, as you call it, for their peers and patients?
So one of the first places that we go, because we're comfortable with this, is to think about what exists that's evidence-based that we can look to. And so a study that was done with colleagues of mine, and in fact, one of the folks who did this study is a co-founder of Civic Health Alliance, Dr. Manisha Sharma, looked at getting individuals to register to vote at 2 family health clinics within the Bronx. These were places that individuals tended to have a high school diploma, tended to have be lower on the socioeconomic income status levels, individuals who were immigrants, and individuals who were rent burdened. So a population that has a lot going on that may not be kind of, those who are like, I'm making time on Tuesday to go ahead and go vote, but a group of individuals that should be engaged regardless. And this study was really fascinating because of the 300 folks who were, that they approached, folks who would come to the clinic, sitting in the waiting rooms, kind of just waiting to get care. Of the 300 individuals that they approached, they found that over 114 of them actually did need some kind of service, whether it was checking that they were registered to vote or registering to vote because they hadn't. And if you think about it, you go to the doctors all the time. It's this place where many of us who, our doctors are busy, you're just sitting there waiting. And so this was an example of a real proof point of the importance of utilizing the time, the trust, the space that exists within healthcare to help people just become more engaged. This study didn't go all the way and say of the people who registered, they also voted, but it was kind of a proof point that this work can be done.
Yeah.
And if I may go forward, one of the things that kind of follows from this, a kind of another, point that we want to add to it, is the importance of the kind of civic health, the health cascade. And I'll just pause here and let us advance the slide when we're ready. So as the kind of second point that I've made of like one, to really be able to do this work, go and look at the evidence of what's been done. The other kind of way to make this case is to really talk about the way in which healthcare and the policies that impact healthcare are connected. And so if you are a doctor in the emergency room and someone is coming in, for example, with evidence of, an at-home attempted abortion, that may have happened because of the result of policies at the state level that impact individuals' access to abortion care, to life-saving reproductive health care. And then you go up one level, higher, and that may have been impacted by how individuals have decided to vote or not vote around those issues. And so even though this is an example of an issue that is very, very political and is very kind of hard to deal with, I would say that we as clinicians, when you see issues like that, the kind of tracking back to the policy considerations that impact them is something that we have to be comfortable doing for ourselves and doing for our peers. Because what we need to kind of take from this is as we bear witness to what it means to have certain policies, we then, I would argue, bear the responsibility to add voice to what we're seeing on the front lines. And so when we talk about civic engagement, we're talking about all the ways that individuals and collectives of individuals participate in communities and public life to address issues that impact their communities. And so this is a kind of a long road of things that can be done, everything from voting all the way to testifying at a public center and all the way up to kind of considering if you yourself want to run for office. We at Civic Health Alliance want to encourage healthcare workers and public health folks to really think about that.
Yeah, I love that. And I will also say when we are talking about these clinical settings, it's not just, federally qualified healthcare centers or hospitals or doctor's office. We're also talking about health departments too, right?
We're talking
Yeah.
about health departments. We're talking
Yeah.
about physical therapist's office. We're talking
Hmm.
anywhere where you go where you're getting any kind of health care. We want
Right.
people to think of themselves as carrying not just biomedical tools of your stethoscope, but also civic engagement tools as well.
Got it. So along that, when we're talking about settings, what are some strategies that promote civic engagement in healthcare settings?
Yeah, so, we've tried to organize this so you can kind of listen to it on different levels. I would say if you're someone who's sitting within a health system, like you work for a large integrated delivery network, or even if you work for a federally qualified health center or a clinic, there are things that you as an institution or organization can do to make it easier for your staff to be civically engaged and to encourage your patient population to be civically engaged. We created a roundtable in 2022 that brought together experts, and we kind of put this into a book that we are happy to send you that you can download off of our website that says what some of those representative activities might be, such as give people an hour or two off on election day to go vote.
Hmm.
Allow your staff to be able to show certain materials that are helpful. So this is one example. And another example is for individuals. And so if you're saying, you know what, my health center wouldn't be interested in this work, but I'd like to do this on my own, the graphic that you're seeing to the right is how you as an individual can engage with an elected official. Now in the world of Zoom and just, as my colleague Benita just spoke about, talking about meetings, you can show up for a virtual meeting or for a public testimonial and communicate with your elected officials about issues that are really important to you. Like I'm seeing some that are shared in the chat around COVID precautions, etc. We've offered a guide for how you as an individual can do this in terms of some of the best practices around communicating. And then I would say, if you're someone who's like, well, I'm an individual and I want my health system to follow me in doing this, we also offer a guide on how you can help convince your health system to do this work because many health systems are afraid, again, that somehow, let's say, get out the vote activities are partisan. And so this guide talks about how it's actually encouraged by law that Medicaid receiving facilities do get out the vote campaigns. And so we share this with you so you can share it with your health systems.
Yeah, so many people don't even know that. And
Exactly.
so,
And then
what about for
finally, this is
communities? Yeah.
Exactly. This is for communities. And so for communities, for folks who are just like, I live in the community and I kind of want to do this, sure, we primarily think about physical kind of health settings. But if you're someone who's interested in doing this in your job, for instance, you can go on to our website and download any of these materials, which come out as QR codes, as flyers or kind of different interfaces. And then we can update the QR codes for you so that you can track how many people you yourself have gotten registered. And I always use this opportunity to remind folks that we're talking about everything from voting yourself to getting out the vote, to letter writing and organizing, to protesting, to, again, running for office yourself. So think about the different ways that you want to show up and lend voice to the issues that matter to you.
I love the fact that you can help communities track that so they can see what impact that they have. That would be so encouraging. And I will say they have a wealth of information on their website. We're gonna chat out it's gonna be on the side in a second, so you can go to the website and check it out. But there is a campaign that is going on right now, and it's called Thrive Through Civic Health, We Will Vote. And can you tell us a little bit about that campaign and how
Sure.
we can participate if we want to?
Sure. So we are not a one size fit all kind of organization. We recognize that people are in different kinds of institutions. They're medical trainees, they're patients, they're attendings. So one of the things that we really invest in with Civic Health Alliance is to offer lots of different ways for folks to get engaged. So if you're someone who's saying, my job would never do any of the things that Dr. Safo was talking about, they would laugh in my face if I talked about getting out the vote on our campus, like, what is she saying? There's another way with the Thrive Through Civic Health pledge where you yourself can go ahead and add your numbers to the thousands of people who are saying, yes, I'm going to commit to voting. I'm going to commit to other people getting out to vote. And so what we're trying to do here is to build a sense of momentum and a sense of we're in this together. We're going to do this together by having individuals sign on. And I want to say organizations as well. So how powerful is it when, the American Medical Association says we're part of this campaign and we're encouraging our staff and our colleagues to get out and vote. And so I want to just kind of offer this as another example of how we're trying to get folks thinking about this work and doing this work. And none of us know your, kind of environments the best. And so if there's even other examples of things that you think could help, we are very open for partnering to figure out how we can do that.
Awesome. And if you want to access some of these wonderful tools, or if you are thinking about how you could partner with the Civic Health Alliance, check them out. Dr. Safo, thank you so much. And we're going to circle back to you in just a second for
Sounds good.
questions. Yes. Our What Works for Health database of evidence-rated strategies include multiple ways to help you strengthen civic health, including creating better opportunities for people to participate and be heard, like you heard our guest talk about today. Now, we addressed two of these strategies with our guests today, public deliberations, which includes having those better public meetings, and voter registration initiatives. But be sure to visit What Works for Health to learn more about these strategies, as well as where you will find a curated list of other civic health strategies. And I'm also going to ask you to share your thoughts on today's webinar. So Colleen is sharing a link to a brief evaluation in the chat, and it would be terrific if you can click on it and finish the evaluation after the webinar. Don't do it now, but thank you so much for chatting that out, Colleen. And now we're gonna get to some questions, Joanne.
Hi, Erica. I have to admit there was such great energy in the chat. I think our audience are also experts at community engagement, or at least have some really great experience. So I hope they come over to the discussion group so we can learn from some of our audience members. But Dr. Safo, I'm going to start the Q&A with you. So Julie and others, they really loved some of these examples that you gave of how healthcare providers can really engage and encourage civic participation. And there was a slide where you shared about ways to model civic engagement in health settings. And Julia just wondered, how can you get doctors' offices to agree to get involved in these ways?
Sure. So we often start by giving an example of hospital closures and how it harms everyone's health. And when people are like, yeah, that's terrible, why is that happening? We'll say, politicians who are able to determine this are more likely to work hard to keep hospitals open for places where there are more individuals that are civically engaged, registered to vote, etc. That's just an opening conversation because it allows people to see the way that civic engagement directly impacts their local environment around health issues that impact themselves or their patients. And then from there, the response we often get is, well, I don't have a lot of time. So how are you going to make this easy? And we say, look, just put up a flyer or two in your office while people are sitting down, waiting to, get checked in. They can point their phone to the flyer and get taken to a website that lets them check if they're registered to vote. Or when they come into your room, give them a card that says, hey, you registered to vote? And they're able to go from there. Things that are more intensive, we can work with them, but that's the easiest, lowest hanging fruit that we always start with of like, make it personable to yourself and then put up some flyers and really start to get people thinking about civic engagement in the health space.
I love that. So it's really an array of strategies that healthcare providers can easily implement, and they can
Has to
go
be
as
easy.
quick and deep as they want. That's perfect. So another webinar participant just wanted to know your thoughts about public engagement and the issue of access to health care, the fact that many people don't have access to health insurance or easy access to healthcare providers. And I know you talked a little bit about FQHCs, but if you have any more insights about how we can make sure we reach that population.
Yeah, it's an interesting question. I was actually meeting with an academic site today that wanted to partner with us on doing a project around civic engagement in their community. And they said a lot of our community members are like migrants that have come from down in Texas. And it's really hard to understand how we can make sure that they have the right kind of like access to platforms that would give them the power to then be able to ask for things like appropriate healthcare, et cetera. And our response to that is that there's just power in the numbers of individuals that show up. I don't know if y'all are following, you're probably not because you're probably all over the country. But in New York, we had a public hearing today about migrant health, and over 1,200 Black migrants showed up to talk about this issue. What that's going to do is it's going to signal to City Council that this is an area that's really important, that even if these people vote or not for them, there's attention on this. Right? So I would answer that question by saying that it's probably worthwhile for us to not get tired because all of us are tired. We've been in a pandemic. There's so much happening. It's another election season, etc. But to think about how we come together to put numbers behind the issues that matter to us. I would argue that healthcare access is probably number one for all the reasons that we know. And so can we have a town hall meeting, invite our local politicians, fill the room with individuals who we know this matters to, and just show by strength of numbers that we want to have these conversations. This is important to us, and we want to continue to move forward on really advocating around that. That's what I would offer to kind of begin.
Great, that's wonderful. And I'm going to pitch one more question to you, and then I'm going to ask Benita to come on. Want you to stay tuned. We might have more questions coming in, but Dr. Safo, one of our participants, you referenced post-COVID, and one of our participants wanted to know if there are some additional examples of how to make healthcare more comfortable in discussing civic engagement, especially because healthcare providers there was a lot of political aftermath related to COVID.
Yeah, I mean, I definitely think it's why I didn't spend as much time with it, but I talk about the policy to health cascade because any person who's gotten into healthcare really cares about what happens to your patients. And so there is kind of a natural sympathy that we have when we think about the patient face of certain policies, like taking out school lunches or, removing access to safe birthing centers, et cetera. And so I think if we start with thinking about the impact of those policies, not the policies themselves or who voted for it, or if it's a red district or a blue district, but if we start the conversation with saying all of us are devastated when we're seeing children come in with bullet holes in their body, what are we doing to think about how to make this safer for our communities. And I often encourage people to start on a local level because federal politics feels almost impossible to wrangle. But on the local level, maybe it's that local, laws can be enacted that keep individuals safe. And so I would answer that question by saying, think about the issues from the kind of health perspective and its impacts on patients and frame it in that way, because people can't argue about wanting to keep their fellow human well. And then kind of go from there to think about what local work can be done to really help to make those conditions better.
Yep, start with the common ground first, right? Thank you. I want you to stay tuned, Dr. Safo, in case we have an opportunity to come back to you. Benita, welcome back. So you did such a wonderful job of outlining some tips for sort of the physical access to public meetings and spaces, but also once you get people to meetings, making sure that it's conducive to participation and in a lot of ways, making sure it's inclusive. But I thought this was a really interesting question from one of our participants about many times there's intentional strategy to limit the airtime of some community members. So in this example, sometimes there are individuals that are pushing a very specific theory or very specific issue in council meetings, and it sort of doesn't leave more space. They sort of take up the airtime or the energy, so it doesn't leave space for, sort of the average citizen to have time to comment. Do you have any examples of how to address this with community members?
We're talking about that in one community as a way to address sort of building community awareness and capacity around a topic. And so, like, for example, one way to address that would be to take on a topic as a study session discussion. So, that's sort of, sometimes it's called a work session or a discussion topic. Sometimes, communities have called them town hall meetings or something like that. But to use the time to say that it's an hour-long discussion about a topic, and to allow for to invite speakers. So to invite community experts. So, in one community, it might be to invite university. So in a community like, the city of Boulder, to invite university experts who bring expertise to the topic and the issue itself, and to have that expertise come to present on that issue. And then also a community member or two who also has that expertise or is known as a leader in that topic. And maybe it's two different sides of that issue, but to have, sort of equal time for that kind of presentation and discussion. And then also an open time for Q&A with all parties, right? But to really have a very deliberative structure that's aligned with that, and community conversation that is a part of that. But to open it and to have a more broadened conversation, but to not structure it in a hearing-like way, or to have that kind of discussion. But we've talked about how to structure that within a community and to bring that expertise forward in a way like that could make sense.
So be aware of the type of community space you're speaking in, and strategize that way. I think we have one more time for one more question for you, Benita, and this is an opportunity to talk more about the democracy innovation training. Can you just give a high level overview of what that training includes?
I'm not sure what type of training we might be talking about here.
Okay, I'm wondering if somebody pulled that from the website. But let's see. Another question from our participant was about voting, and if we do encourage people to vote as a way to be civically engaged, do you have any quick tips? And this is for you also, Dr. Safo, any quick tips to ensure employers support time off to vote?
Yeah, so it's as simple as, I know folks who are in healthcare, we tend to get like best practice alerts. So you go to like put in the aspirin, and there's a BPA that says patients over 75, do they need aspirin? So there's something as simple as your employer having a pop-up note that kind of comes up the week before the election, maybe the day of the election, that says like, today's voting day, like, are you all set to vote or something, right? System-wide emails that go out, allowing people to put in the flyers, et cetera, within clinical spaces to encourage patients to get out. And then one of the things that's really difficult is our staffing models in healthcare are difficult now because there's been lots of people who've retired or left after COVID. And so we are at a shortage. And so there's models that we've tested out of like passing on the pager to different folks so that people can get out a couple of hours off to go vote kind of, at separate times. Folks have noted in the chat that most states have early voting and late voting hours. Unfortunately for us in healthcare, many people will be working from the early voting to the late hours. So you do need that time off to be able to get this done.
Great, really great tips. So Erica's come back on, but folks, again, I saw a lot of you engaging in the chat with great ideas, so I hope you'll join us in the discussion group.
Amazing chat. So I took a peek at the chat log, and let me say, you all get it. You understand what we mean when we say those structural barriers to participation. So hopefully we'll see a lot of you in the discussion group. And I invite you to join us next month for the first of a two-part series exploring structural barriers again, but this time to addressing poverty. So this series will focus on policies and practices that create or maintain unfair and unjust outcomes and bring forward solutions that center equity, belonging, and shared responsibility. So in May, we're going to hear from the University of Michigan researcher H. Luke Schaefer. You may have heard of him, but he's going to join us to discuss the forces behind persistent poverty. And he will be bringing forward learnings from his most recent book, The Injustice of Place. Dr. Schaefer will share how public health practitioners can contribute to innovative, community-centered, and sustainable strategies to address poverty. So you may wish or may choose to read Dr. Schaefer's latest book in advance of that webinar and kind of come with your questions. So we want to make sure you saw the cover of it. Again, we're going to have a discussion right after this webinar to unpack what you heard today. So please plan to continue the discussion with us. And Colleen is chatting out that link right now. Stay connected with CHRNR by subscribing to our newsletter. That's the best way for you to learn about upcoming webinars, any updates that we have. We have a presence on Twitter, or X as it's now called, Facebook, and LinkedIn. So please do follow us there. And I thank you for joining us today. I hope to see you in the discussion group. I want to thank Dr. Stella Safo and Benita Duran for sharing their wisdom with us today. And thank you for all that you do to uphold and advance equity in your communities. I'll see you next month.